Hello, welcome to the Joe Cortez Show here in Las Vegas, Nevada, the entertainment capital of the world, the sports capital of the world, and also there's a lot of medical business going on in Vegas. We have a special guest with us today, Dr. Payman Bady. Dr. Payman Bady is a regenerative doctor who does stem cell research, stem cell surgeries. He tells a little bit about stem cell. This is something that's fairly new to everybody out there, even though it's been around like 40 years. But tell me the latest, what's going on. Welcome to the show, Dr. Bady.
Thank you for having me. I appreciate it. By trade, I was a boarded family practice, emergency medicine, mostly a physician, and then I migrated into regenerative medicine. Stem cells been around for a long time.
Yeah.
The Hispanic culture has been using it with a portion of the brain stem of pigs or baby pigs,
right.
And they used to put it under their skin, and they had all this rejuvenating feedback on it, and it's been going on for a long time. But mainstream has been around for about 30 years or so, and got really popularized when some of the sports figures started using
Tiger
it.
Woods started using it.
Yeah, so
2010.
Yeah, Tiger Woods was really what catapulted to the next step, and I believe he had a knee stem cell injection.
Yeah, it was during the time of the Masters tournament when he got that. Yeah, 2010. I remember that.
Is that yeah? I don't know. I'm not a big sports guy. I'm just a big tennis and ski guy, you know.
Yeah.
But I try to take up golfing, but a lot of doctors golf, and I just don't like it. It's too slow, and you know. But anyhow, yeah. So he started that whole movement, I think, and since then there's been a lot of clinics. We've been around for about 5 years now, 4.5 years.
Here in Las Vegas?
Here in Las Vegas. I've been in Las Vegas for about 29 years now.
Okay.
So the healthcare here in Nevada has really evolved, but our stem cell company, Cellaxys, has been around for 4.5 years. We focus on orthobiologics, meaning mainly joints. We do some cosmetics as well.
You do something with spine surgeries?
Yeah, and on the joints we do spines as well. So there's a lot. We do actually intradiscal, which is injections within the disc,
right?
And also we do on the articular surfaces of the spine, which is like the mobile joints in the back. So Dr. Mahajer, my partner, is a Harvard trained, fellowship trained spine guy that does pain management for spine.
Yeah. Now you guys are all physicians, all board certified.
All of us are board certified, yeah. And there's 3 of us. Dr. An, my other partner, he's a joint specialist. He's a sports medicine guy that does all of our joints and tendons and small joints as well. We have a pretty solid group, I believe. And we've been doing it for 4.5 years. We have a lot of people come from all over the world, to come and see us. We actually do the procedure in the office, meaning that we extract. There's 3 ways to extract stem cells. So people call it PRP.
Right.
And PRP was more mainstay. More people talk about it because it's easier to obtain because we get it from the blood.
Right.
It's like going to the lab and getting a blood drawn, and then you convert that into stem cells, or what we call PRP,
right.
Plasma-rich protein-rich plasma, and we inject that in articular surfaces, face, hair.
Hair? Ooh.
Yeah. Well, for most people, if you don't have a lot to go with that, actually that goes with anything, even in the joints or in the disc space or so forth. If there's not enough of the material that we try to rebuild and regrow, then the likelihood of it coming out is not very high.
Well, a lot of males would like to go there for kids self say, something is not right in my body. I want to make my body parts bigger.
Yeah, yeah, yeah. That's yeah. There is also a female and a male component to it.
Yeah.
For men with erectile dysfunction,
That's what I'm talking about.
and some women that don't experience normal climax.
Right.
We do that as well in our facilities, but essentially anything was considered regenerative.
Right.
That's what we do.
How long does it take? Let's say you get injections put in your body for whatever part is being worked on. How long does it take for it to kick in?
Great question. Every patient is different,
Okay.
right? So we have a spectrum, but so our larger joints is what we do most, like
Okay.
knees, shoulders, hips, that sort of thing.
Lower back?
Yeah, lower back. I actually had stem cells done in my back 2.5 months ago.
Why was that?
I actually, I'm 55 years old, but when you look at my spine, it looks like a 75-year-old spine because I've been very rough on my back. And my brother's a local spine surgeon, actually. And I showed my MRI. I actually one day just got up. I was doing some aggressive sports.
Right.
And one day I just got up and I couldn't walk 5 feet. Actually, it took 3 days to get there, but I had some numbness in my leg on my left side, and I just couldn't walk. And I got to a point that when I walked into my patient's room, I had to sit down for about 2 or 3 minutes and hunch over in a flexed position to take the pressure off my spine before I could even talk. That's how bad it got. Got a couple of epidurals, and my brother, who's a spine surgeon, was like, surgery, 2 weeks, no questions. I'm like, no way, I'm not doing it. I'm not doing it. So, once you have a fusion, then the next level goes and the next level goes. And I had a 2-level issue. I have a 2-level issue. So I had the largest stem cell procedure we've done on anybody in our facility on my spine. I had a 3-level disc injection with all of our facet joints, which is the articular surface of the spine, and also some nerve blocks. And I'm 2.5 months out, and you saw me walking in here normally and so forth. So I did really well, and I'm 2.5 months out. Usually, right about 30 to 45 days, you start feeling the difference. It gives some time for the stem cells to reproduce, and the graph keeps going up, and really the maximum efficacy of the growth, I think, is about 9 to 16 months, right? And then it kind of plateaus after that.
And it stays there normal for the rest of your life?
Well, it depends. It'll be your new baseline.
Okay.
Now, people that do crazy stuff like I do, or lifting, or runners, or whatever you've done to your spine, your joint, whatever, you continue doing it. If you're
Motorcycles?
yeah,
Motorcycles do it, eh?
yeah, motorcycles, and if you're heavy set,
Uh-huh.
and the reason you formed arthritis or joint or articular surface destruction is due to increased weight on your joints, and then it's going to happen again. We have patients. Some patients have started kind of going down a little bit, about 3 years out, 4 years out. Very few. We're hitting our 5th year in doing these kind of stem cells, and we're beginning to see a few more come back. But it's a good number. PRPs, what we get from the blood, don't last as long.
Okay. Now, you recommend that they do a physical therapy after these procedures?
Oh, for sure.
Okay.
Absolutely.
That's part of the program, right?
Absolutely.
Okay,
Yeah,
so
yeah.
they do in your location. They
No,
also send to another
no.
location.
No. We use a particular group of physical therapists that understand this. It's not your typical orthopedic procedure, right? It's not. I mean, I think I was a little different. I didn't have much pain after the procedure. Usually, there's a lot of pain for the first 2-3 days, especially in the spine. But I started physical therapy on my 8th day post-op.
Okay.
Post-procedure.
Right.
Right. And I go to physical therapy 3 times a week.
Okay. Now the FDA has not approved this yet, or what? What's going on with them?
No, there's certain limitations that what you can and what you cannot do, right?
Is it because this is not medical stuff? I mean, this is not drugs. There's no drugs. This is within yourself. The stem cell, we use the PRPs from, you take it from the person's body, right?
Yes.
So is that the difference? Why is not FDA approved?
Yes. So what this is, all of that we do is still considered investigational, but it's allowed, right?
Right.
Some people buy cord blood from infant gone from the placenta or from the umbilical cord derived. There's some exosomes, which is an external material that you buy, and we don't do that. We only use material from your own body, either from your blood, your fat, your adipose tissue drive, or bone marrow. For example, the spines, we use bone marrow. Mine was a bone marrow derived stem cell, it really performs well as far as we're concerned. Some other people believe that placental stem cells are much better because they're more embryonic in nature, but we really don't know the amount of denatured number of cells, meaning damaged cells, or going through phases of heating or freezing or whatever. What we do in our facilities, and there's other facilities that do it like ours in the country. There are not that many. Is we actually have an operating room in the back, and you come in. For example, I went in. There's an anesthesiologist, so they aspirate some bone marrow. We take it to a lab, and we take the stem cells out, and we inject it back into the area that's needed within 30 to 45 minutes.
Now, the health insurance, does it cover, health insurance cover this? Or?
No.
They
But
don't cover.
if you allow me, Joe, let me go back to the question you asked about the FDA, right?
Right.
So what the FDA doesn't like to do, which is completely banned and not allowed, is to actually get the cells and regenerate and regrow them and keep them in a situation that, or a medium that you're growing more cells, right? Or you're developing more cells. So that's not allowed.
Okay.
Insurance doesn't cover it.
It doesn't cover it. How about for cosmetic? I mean, all that same thing. No insurance covers it.
No, none of the procedures.
But you guys handle financing for them?
We don't handle financing, but we have companies that they could use for financing.
Okay.
That they could get the procedure done, and it's between the patient and them.
Yeah.
Right. We're not in the business of.
No, but I know, but I'm saying you refer them to a company.
Yeah.
That's a referral for financing.
Yeah. And so there's a lot of good information on our website, Cellaxys, which is like a cell around an axis, so there's a lot of information there, and patient responses on how they did.
Right. Now, the procedures are done, you said, they come into the office, they get a consultation, and they go in there, they see what? After the consultation, when does the procedure start after the consultation?
Well, the first consultation is with one of our physicians to even see if you're a candidate, right? We usually don't want to do procedures on people that we don't think we can help, right? For a couple of reasons. Obviously, we want to be efficacious in what we do. And secondly, we're doing an internal study on how the improvements are on what we do. And we want to really select people that we can help. And if something is really surgical, if you are truly bone on your knee and there's nothing left, we can't help you. Yeah. Or if your spine is at a place that you're really impinging on a nerve in a level that the increase in hydration of the disc would not allow any reduction of the impingement, we can't help you. You're surgical.
Now you say you have a brother who's a spinal cord surgeon. What does he say about the procedure that you had done and see the way you are today? What did he say about that?
Believe it or not, I haven't had a chance to sit down with him 2 months out and talk about it. We're both super busy.
Yeah.
But he is actually open-minded. Look, I always say this: to all of our patients. Like to a hammer, everything looks like a nail, right?
Right.
We want to do stem cells because we believe it's the future of medicine. Surgeons want to do surgery because they think that, and it's true. And there's always a gray area,
Yeah.
right? And the gray area in this could be a little bit larger than the gray area in some other parts of medicine. But my brother, who's a spine surgeon, has referred us patients that he thinks that they'll benefit from, and they're not good surgical candidates, and they're not severe enough to be surgical.
Yeah, so if he's a good candidate for stem cell, he refers them over to you, which is good, and vice versa, I'm sure.
Yeah. We send them patients.
Yeah.
We use. I mean, we actually send people to where we think they do best. So if it's my brother's an orthopedic spine surgeon, right? So if somebody needs a neurosurgeon, we think, even though there's some overlap, we will send them to a spine neuro, or if there's a shoulder issue, we'll send them to a shoulder specialist, or so forth.
Now, what is the age range of the surgery procedures? I mean, from what age? This is not done for I'm sure, for younger folks, and mainly for older folks. Am I correct, or am I wrong there?
No. We actually have had some. We do a lot of the UFC guys.
Okay.
We do a lot of other sports people that are younger, and they have aggressive damage to their joints. They have tears. They have ligamental issues.
So this is more like a lot in the sports field.
Or all our best outcomes, believe it or not, are on patients that are 60 and over.
Really?
Yeah, we have a really good outcome on 60 and over, but we generally have a very good outcome across the board. There's obviously the spectrums, the ones that do really, really well, and the ones that don't do well or have some complications or whatever, which is normal across the board.
So nothing is guaranteed, but it depends on one. It depends on the individual themselves. Not everybody's the same. Some recuperate faster than others. Some stay at the same level, or some have to come back for a second treatment.
No, the stem cells, if they really didn't work the first time around, it's not going to work the second time around,
see,
right? The PRP, however, is different. PRP is kind of like baby steps.
Right.
To getting stem cells, right? So we do PRP the first time, second time, third time. At that point, I was like, you need stem cells because you're responding to PRP, but you need something really much more powerful.
Can you explain to our viewers exactly what is PRP?
Yeah, PRP is the stem cells derived from blood as opposed to fat or bone marrow, right? And they're good. They do work. They have a great anti-inflammatory response to them, but they're not as efficacious as adipose or bone marrow.
Now, let's say a person has an auto accident and the injuries is bad, but not that bad for that person to be hospitalized. But they need definitely need some kind of work to be done on them because of the injury. Now, I have a daughter who was involved in an auto accident. She has a severed spinal cord, so she's a quadriplegic. Now, this individual being in an auto accident or falling off a horse, like Christopher Reeves, when he fell off a horse, he ended up being a quadriplegic, paraplegic from the waist down. Mm-hmm. And that's different. Paraplegic from the waist down. Quadriplegic is like my daughter. He had vertebrae 6 and 7 that was broken, and so it was severed. So this is caused a lot of individuals to how do we recuperate? How soon can somebody have an accident and be a candidate for stem cell?
That's a very open-ended question. First of all, one end of the spectrum is that the completely severed spinal cord. That we can't do. And in fact, there's a lot of studies that are coming out in stem cells. With stem cells that are addressing that particular issue, but I don't believe we're even close to where we can actually connect the severed spine, right? And to be honest with you, I'm not that well versed on it, so I don't know that much about that.
Well, they're doing that. The Spinal Cord Research Center, the Christopher Reeve Spinal Cord Research in Irvine, California. They're doing the studies there. Different places around the world doing studies on stem cell. But to get federal funding, it's kind of difficult.
It is.
To get to that level. I mean, it is the latest and is probably the best way to get you back where you should be. But the federal government is not 100% behind it. I mean, they have given some funding in the past, but not as much as is needed. And it's something that I think they're lacking. The government is lacking. They have to be educated in reference to what goes on with stem cells. There's not enough information out there for them to convince them to go all the way.
Yeah. I agree with you. The FDA is doing their job to make sure that people don't get hurt.
Yes.
And I understand that. But as far as a patient that's been into a traumatic accident, it all depends on what kind of trauma was it, right? So if it's ligamental and tendons, I think once the swelling has gone down, and by the way, PRP really is, again, it's an anti-inflammatory, so it works really well with swelling and inflamed tissues. But I believe that there needs to be some amount of recovery, and then we can help with the ligaments or joints or so forth.
Now, how was the any side effects from these stem cells injections?
Not really. Look, obviously, infection is a possibility, right? Whenever you inject something in the joint, especially the spine, has a higher level of
Side effect,
infectious possibility. There is a granulomatous tissue production, means that they could overgrow sometimes, but usually not from your own tissue.
Right.
When you get stuff, exogenous material like exosomes and so forth, we've seen some outcomes with the exosomes that had shown some increased inflammation and rapid formation of the granuloma, what we call it, and that could be a side effect. But for the most part, we don't see a lot of issues.
Right. Now, so the infection that you can catch from this is something that is very, very rare, but it's a low percentage of people having. We talked about side effects. It's very, very rare that they will get infections, and different procedures may be needed if that doesn't work out. I mean, let's say somebody goes in and they have the side effects where they are not it's not working for them, but you feel that maybe you didn't inject enough of that PRP into them, it was not enough, or should it come back for a second? Was there second treatment or third treatments?
So that, with a PRP, that's definitely an option, because unless it's in a ligament and so forth, if it's a joint, I personally recommend going straight to stem cells, right? But if they fail PRP, they get a second PRP, then we would consider doing stem cells. But someone that had no response to PRP would likely have a lesser response to adipose-derived stem cells, for example.
Good. Now, what's on the horizon for you, and you can see in the stem cell industry now? And the stem cell community is something that, again, is kind of new because it's not really been out there because the FDA has not approved it until the FDA gives the final approval, a stamp of approval saying, we're you guys 100%. But do you see anything on the horizon that looks promising?
Yeah, so on the regenerative side of things, I think there's a significant push on biohacking or bioidentical hormones, and as a whole, there is a big push, and that's one of the things that we're doing in our company, is that we keep the stem cells as part of our arsenal of all that we could do. Right. So we want to be able to increase a person's production of more cartilaginous material. Now we can't do it orally,
Right.
but there's a lot of peptides now that increase your collagen levels, and hence you can increase the possibility of collagen throughout your body, in your joints, on top of stem cells. So it's a multi-pronged approach to enhance keeping us alive and mobile longer.
How about the cosmetic stuff? That I mean, they have this plastic surgery, cosmetics. You know, people want to just like they use other kind of facilities for other type of treatment for cosmetic. Do you guys specialize in anything like that?
We refer out to a group that we're working closely with, that they do all of our super high-end cosmetics. We do the basic facial PRP and hair PRP within our facilities.
Right.
But there's a lot of plastic surgeons that have reduced their actual surgical OR time with using stem cells to reshape the facial structure or
Wrinkles and things like that.
absolutely.
Yeah. And you said at the age limit, the older you get, you're going to need some kind of. Everybody wants to get some kind of to beautify their bodies. They want to make themselves feel like young again, and a lot of it has a lot to do with the way you feel about yourself and how you say, well, you know, I look at myself in the mirror and say, you know, I remember 20 years ago I looked so much different. You look at photos and you say to yourself, wow, maybe I should go and get some consultation, see what I can do to keep myself looking young again. I mean, not everybody could be my age and feel, you know, like a 20-year-old. I mean, I feel good and young, even though I'm up in age myself, but there's a lot of folks out there that are much, much younger than myself, and they look like, well, like they're 30 years older than what I am, you know. So I just, you know, think that the cosmetic is good, you know, it's a good way to go. But I think you guys are more on the medical side and looking to for joints and spine, things like that. That's more important, I guess.
Yeah, I think it's a combination of all of it. I think it's a combination of keeping yourself. I've been practicing for 30 years now, and you know, you open the door and walk in a patient room and you take a look, and they look much younger than their age or much older than their age. And I always say, I got 60-year-olds that look like they're 90,
Yeah.
and I got 90-year-olds that look like they're 60. You know, and that is, I've seen that throughout the years as we become more knowledgeable as physicians, healthcare providers, and so forth, in understanding how to manage diseases better, stress, diet, biohacking, stem cells, and all. The more we have in our arsenal to make us younger feeling, I think is the most important thing, right? Again, I'm 55 years old and I have a bad spine, right? That's the last thing I want. I have so much energy, you know, and so forth. So keeping that youth feeling, to me, is more important. I don't want to be a 95-year-old that is stuck in a wheelchair and can't move, right? I'd rather not be here, you know. Right. But I would love to be a 95-year-old that is walking around, moving, eating on my own, doing whatever I want to do. Maybe not drive, but that's my personal goal, and that's my goal for my patients through stem cells, regenerative medicine, diet management, medications, good internal medicine docs, etc.
Yeah, you know, exercising really is keep yourself physically fit, and watching your diet is very important because a lot of things can be avoided, especially if you keep yourself active. You keep it. They say if you don't use it, you lose it. I believe in exercising, keeping yourself always, even if you get up in the morning, you stretch a little bit, do some exercise, 10, 15 minutes, do something, bend over, you know, side, do some kind of exercise. A lot of folks just don't do anything. They use a couch potato. They sit there all day long watching TV. They put on the weight. They're not exercising, and then their life falls apart. And I think that this is what we have to try to educate our viewers out there, is to keep yourself physically fit, keep yourself ready, and always eating healthy and check it up on one another, because these days, you know, times are really getting difficult these days, and especially with all this pandemic with the coronavirus and different diseases that are out there, people that smoke a lot, people that drink a lot, it makes your body fall apart. So that's why I brought Dr. Bady on the show today to talk about stem cell, because I think it's something very informative. if you want to get yourself back on the right track and release some of your pain, you let the doctors concentrate on relieving your pain so you can concentrate on your health. But these doctors are doing a great job, and Dr. Bady, want to thank you so much for being on the show to give the information to our guests today.
Thank you for having me. Appreciate
Again, now
it.
they want to reach you again, they can reach you on the websites and
Yeah, Cellaxys, Cellaxys.
Cellaxys, and a phone number.
Yeah, 702-834-3434.
Okay, very good. You got it there, my friends. We'll see you next week. Take care. Thank you so much, Doctor.
Thank you.